brand new. I'm sure that you're all familiar with the injectables, because I know that you do a lot of HA injection here in Saudi. And we will discuss. I like the interactive course, so if as soon as you have a question, you just raise your hand and you can make your question. Before starting, just one word, because of in the memory of my friend Sheikh Hussein. I was really close friend with Sheikh Hussein. I had a very particular relationship with him. He came several times to France to visit me, to Lyon. And each time I was here in Jeddah, I was spending time with him, with his family. And it is that was a very sad news that I heard about last summer. And God bless him, really. It was very hard for me. I know it's hard also for you here. Okay, so let's talk about the facial aging. You know all this image. The aging process is a combination of skin aging, ptosis of the teguments of the skin, and more than that, we have a combination of atrophy and hypertrophy. So it means that by the aging process, we are losing volume in the upper part of the face, in the temporal area, in the forehead, in the eyelid cheek junction, in the mid-face, and during the same time, we are gaining volume in the lower part of the face. So when you add hyaluronic acid filler 1 time, 2 times, 10 times, we are getting more volume, but we are not removing volume in the lower part, which is actually a big part of the facial aging process. This is a video from one of my friends in France. He's an artist. His name is Frédange. You can go on his website and check his works. He's an anatomist, artist, and you will see that he's creating a face of 35 years old woman, Caucasian woman, and then the same sculpture, he will turn it into 50, and you will exactly see, this is 35 years old woman, and then he will transform this into a 55 lady. So look at what he's doing. He's removing volume on the forehead. He is removing volume in the temporal. He is removing volume around the eyes. He is removing volume under the eyes, at the eyelid cheek junction here. He is decreasing, creating these wrinkles on the lower eyelid. Look at the work he is doing in the mid-face. This is a huge part of the aging process. Then he is getting volume in the nasolabial compartments. He's making deep the nasolabial fold. Again, removing volume on the lateral cheek. Adding volume on the jaw, here, at the corner of the mouth, and decreasing the projection of the chin. The nose is turning down, nostrils are larger. You see that? Nostril is larger, then the radix of the nose is deeper. And look at the quantity of volume he's adding into the neck, into the lower part of the face. The ear lobe is bigger than before. The lateral part of the eyebrow is going down. The upper lip is longer than before. The lower lip is shorter. You see here the volume. This is a very, very tough area to treat. These two sulcus on the upper lips. The commissure. Again, more volume in the jaw. and more volume in the neck, anterior neck, lateral neck. And then he's making some finishing to this. Superficial wrinkles in the forehead, in the glabella. So by looking to this video, we really understand what's happening by the aging process. So when someone comes to your office, which is not a young, which is a middle age, and she wants to be treated, actually what you have to offer the patient is the opposite of this. So each detail on the forehead, temporal, orbital rims, eyebrows, lower eyelid, tear trough, nose, lips, perioral area, chin, cheeks, every detail that you have seen in this video, you just do the opposite way. Okay? So it's easy for us to add some volume by HA injection, but it's more difficult to remove volume, especially if you are not a surgeon, if you cannot do a liposuction on the neck or a neck lift. Do you have any question on that? Is there any question, any remarks?
How long it took him to do this sculpture?
He's very fast, you know. We invited him on a congress, on a meeting. He had a booth, and it takes like 3-4 hours to do a sculpture like that. But the video was not finished, because then he's going from 55 to 75. And it's, by the way, it's exactly the same thing. He's exaggerating the deformities, but it's amazing. It's very, very interesting. Okay, before injection, because I don't know which level of experience you have. Before starting to inject, the most important thing to know is the anatomy. And within the anatomy, you have 4 items to control. Then we have to know the semiology, we have to know how to analyze the facial semiology, and then arrive the technique of injection. In which area we use the cannula, in which area we use the needles. Okay, but before talking about the technique, you have to be an expert in anatomy. And the most important part of the anatomy are the vessels. Because if you have any kind of vascular problem, the patient will never come back to you. That will create a lot of headache for you to treat, and it can sometimes turn to dangerous complications. So it is very, very important to know the vascular anatomy. So the basic thing in vascular anatomy is this image. I'm sure you all know that, right? All the orange area is vascularized by the branches of the external carotid artery, ECA, and the pink area is perfused by the branch of the ICA, internal carotid artery. Okay? So it means that the periorbital area, the central part of the forehead and the dorsum of the nose, we have small arteries which are connected to the ophthalmic artery, which is connected to the internal carotid artery. So any kind of embol in the vessels in this area can turn into blindness. Okay? Because these arteries around the eye are connected to the ophthalmic artery. And this is the most, the glabella and the central part of the forehead This is the most dangerous area in terms of ischemic problems and necrosis. Here, if we have to make a ranking in the dangerous area, the most dangerous one is the glabella. The second one is the nasolabial. Okay? So, are you able to give me the name of these arteries? Here. Everyone knows these branches? What is the number 12? Facial artery. Perfect. What is the number of 17? Superior labial artery. What is the name of the 15? Inferior labial artery. What is the name of the 20? Infraorbital artery. If someone doesn't know, just stop, okay? What is the name of the 10? You know this? Transverse facial artery. What is the name of the 8? Superficial temporal. Superficial temporal artery, because there is another one which is deep temporal artery. Okay, superficial temporal artery. What is the number 2? The glabella. Here. What is the name of the number 2? Supratrochlear artery. Okay? What is number 1? Supraorbital artery. What is the number? We did the most important one. What is the 19? Angular artery. 18, you know what is 18? No, this is the lateral nasal artery. The one which is going from the facial artery to the nose. Lateral nasal artery. The columellar artery is here, 17.2, in the columella, here, right there. Okay? And number 3 here is the dorsal nasal artery, the artery on the dorsum of the nose. So you see that the red vessels, they all come from the external carotid artery. The pink, they all come from the ophthalmic artery. That's why the color is not the same. So in this area, in the dorsum of the nose and in the glabella, the arteries are connected to the ophthalmic artery. Is this clear for everyone? Yeah? Okay, so now let me show you a real image. This is not an illustration, this is a cadaver. And we have dissected the skin. And look at, it's exactly the same, but in reality. So we have the facial artery here, superior labial artery, inferior labial artery, lateral nasal artery, angular artery, infraorbital artery, superficial temporal artery, the vertical branch, and the frontotemporal branch, the supratrochlear artery, the supraorbital artery, the dorsal nasal artery. Okay? Is there, and the infraorbital artery here. So is there any question about that? So please listen. There is no variation on that. Never. Okay, so you have to know this by heart. It's always the same thing for each of us. But you have really to know the name of the arteries, the source of the artery, and more than that, you have to know the location of the artery. You have to be able to tell where is the facial artery at this level, where is the facial artery at this level, where is the facial artery here, where is the superficial temporal artery, where is the infraorbital artery. You have to be able to give the exact position of the artery in different area of the face. Okay? Are you able to do that? Yes? Where is the facial artery here? Which is the position of the facial artery? Deep, exact, and where? How do you know where is the facial artery here? The sulcus is not easy to palpate. What is the landmark? The masseter muscle. Look at here. This is the masseter muscle. So the facial artery is just in front of the masseter muscle. And how about the commissure? Where is the facial artery here? Superficial. And where? From the commissure to the facial artery. 15 millimeters. 15 millimeters from here to here. Okay? Then the facial artery is just along the nasolabial line, just beneath the nasolabial line, superficial, so be careful when you treat the nasolabial line, because this is one of the second most dangerous area. Then the lateral nasal artery is located here, 3 to 5 millimeters above the nasal groove. You see the groove here on the nose? 3 to 5 millimeters above, you have the lateral nasal artery. So I give you the landmarks in millimeter, and I will show you in a model that the arteries are there. So if you know that, you will be very comfortable when you will inject. Whatever, if you use cannula or needle, doesn't matter. You know where the arteries are. The infraorbital artery here is on the pupil axis, 11 millimeter below the orbital ring. Okay? Then the superficial temporal artery is 15 millimeters in front of the earlobe. Here, the ear, 15 millimeters. The bifurcation is at the level of the helix insertion. You see here the helix insertion, the bifurcation is there. One branch is vertical, the other one is 5 centimeters from the tail of the eyeball. Or if it is a short forehead, short temporal area, the frontotemporal branch of the superficial temporal artery is just at the level of the hairline. Just at the level of the hairline here. The only branch in the lower part and the midface which has not a constant pathway but sometimes shorter, sometimes longer, is the inferior labial artery. The inferior labial artery usually starts very far, sometime at the beginning of the facial artery. It's not a direct branch, the inferior labial artery. The inferior labial artery starts very far, and it has a long pathway to the inferior lip. That's why you have a lot of ecchymosis in this area. Look at this. One of the areas that we get the most important ecchymosis is there. Patients are blue here because look at the cadaver dissection, the facial artery. You see the superior labial artery is a direct branch, but the inferior labial artery is not a direct branch. It starts very far, it has a long pathway, a lot of small branches, and then it goes into the lower lip. So all these small branches will give a ecchymosis in this lower part of the face. Okay? And by the way, if you look at carefully, the superior labial artery, the inferior labial artery, they do not penetrate the lips from the beginning. They go into the lips after 10 millimeter here. So the corner of the mouth, really the corner where the commissure is, you don't have vessel. The superior labial artery and the inferior labial artery penetrates to the lip 10 millimeters away from the corner of the mouth, here. So, superior labial artery is a direct branch, inferior labial artery is a very long artery, and it starts very far and then it goes to the lip. When the arteries are in the lip, look at this ultrasound, this is very interesting. When the arteries are in the lip, it is in the posterior part of the lip, deeper than the orbicularis oris muscle. So when we will do the lip injection, whatever is your technique, if you do longitudinal injection or vertical like a Russian lip, so we have to pay attention to these arteries, this and that. But imagine when you do the Russian technique, when you do the vertical injection, we go from the border to there, but we are far from the artery. Okay? Look carefully at these images. Artery and vein are in the vestibular part of the lips. Do you have any question on that? The next part of the facial artery is the nasolabial, here. And as I told you, the facial artery is located just below the nasolabial lines or 1-2 millimeters lateral to it. So when you inject this area, first try to work in the deep plane because the facial artery is located superficially. Try to work in deep plane and then never go lateral to the nasolabial line. Always stay medial to it. This is the superficial, this is the supratrochlear artery, here. The position of the supratrochlear artery is 15 millimeters from the midline. This is the nose, here. 15 millimeters from the midline, you have the supratrochlear artery, which starts deep on the bone and turns more superficial in the forehead. And the second one, which is the supraorbital, is located at 30 millimeters from the midline. Okay? So now you have almost all the locations of the most important arteries of the face. The last thing you should know is this. This is the temporal area. This is the zygomatic arch here. This is the temporal muscle. Look at from the skin to the temporal muscle, we have the superficial temporal fascia and the deep temporal fascia. Okay? You follow me? Yeah. Then we have the superficial temporal artery. We have the superficial veins. And if you look at carefully, the superficial temporal artery and the superficial veins are above the superficial temporal fascia. So in the temporal area, there are two techniques of injection. One, you use the needle, you go perpendicular from the skin to the temporal fossa. We call this the gunshot technique, like this, boom. You use a needle, you go vertical, you go until the bony structure, which is the temporal bone, the temporal fossa. So we will be here. And then you make a bolus and it expands the deep temporal fascia and it expands the superficial temporal fascia. This is one technique. The other one is using cannula, going from zygomatic arch or from the temporal crest. And in this technique, the right plane is this one. We go just below the superficial temporal fascia. We are not subcutaneous directly, because here the skin is very thin, and when you inject HA in the subcutaneous, you can get irregularities. So the right plane is to be below the superficial temporal fascia, here. This part, okay? And to be in the right plane, in my opinion, it's easier to go from the temporal crest like that, in order to go from the zygomatic arch and go up. It's easier to go from the temporal crest and going down with the cannula. And because of the curvature of the bone, you will be just in the right plane with your cannula, like this. You will be here. In this area, you don't have any vessels, you just have the branch, the nerve branch. You see the white structure? This is the frontotemporal branch of the facial nerve. So do you have any question on all these anatomical structures? No question? So what I suggest is that we will take one model and then we will talk about the rest of the anatomy. Okay? We have a model or this is a mobile. This is a mobile device. So you remember what we said? The masseter muscle. Press your teeth. So you palpate the masseter muscle here. Turn your head here, and at this level, deep on the bone, we should be able to find the facial artery. So this is, look at this, this is the skin on top, this is the bone, and this is the muscle. Press your teeth, huh? Like this. Relax. You see the muscle here? Masseter muscle. So now I will put on the Doppler. You see the facial artery? Exactly under the mark I put. On the bone. Here. So the facial artery is there. Okay, now let's go to the lip commissure. Facial artery and vein. You see that? Do you have a ruler? So you see that now it's more superficial. The skin is here. Perfect. This is a wonderful image. Look at facial artery and vein. And these are the teeth on on lateral side. These are the teeth. Okay, right here. And look at what I told you. You remember the landmark I gave you for the commissure of the lip? How many millimeter? 15. Okay, look at this. You see that? So when in the Congress meetings, doctors and instructors, they say, oh, variation, there are a lot of variation. There is no variation.
It's same from
Everyone.
Everyone.
Yeah, same from everyone. Look at again. Facial artery and vein.
Red color artery and
Red color is artery and blue is vein.
Okay.
Okay? And then from this part, the facial vein will go away from the facial artery. Let's see the nasolabial part. This is the most difficult part. Here, do we see it? Here. We have the facial vein, facial artery. You see that? Show them. We have the facial artery and no more facial vein.
only artery.
Only artery. Because then, in the mid phase, the facial vein is going more lateral and more deep. And this is very interesting to look at how superficial is the artery now. We have only like 2 millimeters from the skin to the artery. The bone is here. Very superficial. And the most important thing, can you show this from here? Look at where is the artery compared to the nasolabial line. Can you see the line of the probe and the nasolabial line? I will draw it for you. So her facial artery is there. 15. Here. have a white pen? The facial artery is there. Smile, smile. Okay. You see, we are few millimeters lateral to the nasolabial line. This is very interesting, but very superficial. So with the ultrasound Doppler, you can see everything. Let's see the upper part. This is very important too. Look at this. Amazing image. So, where is the line? The line is here. Okay? The bone is there, so we are almost in contact to the bone, because this is the frontalis sinus. And the artery is there. Okay, so let's check. Thank you. So the artery is there, and the midline is there. You remember landmark I gave you? Can you zoom on that? Yeah, 15 millimeters. The supratrochlear artery. So, and I told you the other one is at 30 millimeters. So, somewhere here. We will check. So, what does it mean? It means that when you want to do the glabella, try to stay in the middle. Because when you are right in the middle, as you can see here, show the ultrasound Doppler. When you are right in the middle, in the forehead area, we don't see any vessels. We have the skin, the subcutaneous layer, muscular layer, and the periosteum, the bone, in the white part. And look at when I move to the lateral, then we start to see the vascular structures. Here the artery, supratrochlear artery, at 15 millimeters. And let's go to the supraorbital part. Look at the supraorbital artery. You see that? Amazing view. Supraorbital artery. And look at this. 3 centimeters. Can you believe that? We had a discussion at the last IMCAT. I don't know if you were at the last IMCAT in Paris. Because I'm the only doctor surgeon who is doing ultrasound. Usually the ultrasound is done by radiologists, but they don't have the same knowledge of the anatomy because they don't care about these vessels. So every single artery that I show you in my laptop is there at the same exact location. So we will never forget this. You want to see the temporal, superficial? Turn it. Turn. So I told you 15 millimeters in front of the ear lobe here. You see? And then I told you at the hairline, like this. And here 5 centimeters. But let's check. I brought this device only for you from France to show you the arteries. Here the artery. Here. You see that? So, look at carefully the planes. This is the skin. This is the subcutaneous layer. As I told you, the artery and vein are above the superficial temporal fascia. This white line here is the superficial temporal fascia. Okay? Then this is the connective tissue where we should inject the hyaluronic acid here. Then this is the deep temporal fascia. And look at, can you zoom on this area and you see exactly on the line and I have drawn. Can you record line? Look at the landmark of the probe here and the line. You see? Exactly at the right location. Can you give me a syringe of L with the needle, or with the? Do you have cannulas? Okay, with cannula, but just a needle and a cannula. So let me show you something very interesting. We will do the injection under the control, ultrasound control. Is there any question? Do you like it? For the temporal area, as I told you, I like to go from the temporal crest. This is the temporal crest. Okay? This is the lateral orbital rim. So I like to make a small hole at the level of the temporal crest here. So you know that you see the line of the artery. So don't go on this line because we know exactly where the artery is. We know the perfect location of the artery. So I go just below the artery and then I will put the cannula in, you see? And I will let the cannula go on the right plane. Now we are in the right plane. Can you hold this, sister? Okay. Now let's check. Okay, you see the artery. So as I explained to you, this is the skin. This is the superficial temporal fascia with the artery and vein. So I will, can you show this area? So under the control with the probe, using the needle, I will go deeper than the vessels. You see, in a deeper plane, so it is safe. And then we will inject this area. Can you hold this again? So you see can you show that? Vessels are there, superficial tempora is there, and the cannula is just beneath the superficial temporal fascia. So I will inject this space. Okay? I'm pushing the filler. Start again. Can you hold this?
Bakit?
There you go. There. It will be easier. So now I have the full control of what I'm doing. So the idea is not to tell you that you should inject under the control of ultrasound, because this is impossible. It will take too much time to do one patient. But the idea of this workshop is to show you that what we are doing is completely safe, because we have a full knowledge of the anatomy. Do you understand? Can you show the camera? So you see that, sister, can you hold this? Artery is there, and I have injected this area. Okay? So then I will turn this off because can give me gas. So now to treat the temporal area, starting with this entry point, we do a fan, retrograde technique. Okay, perfect. You see here the difference on the upper part of the temporal area compared to this part. So I will do the same thing here. Give me the marker pen. Thank you. The temporal crest, the superficial temporal artery.
ما في بنج لو سمحت ما في بنج بنج ما في
Yeah, no need. And then you do the same thing here. Breathe, nafas. In this area, you also have the sentinel vein that you have to make attention to it. So a fan technique injection, posterior beneath the superficial temporal fascia. you have some lidocaine with the 30 gauge needle? So this is the way to treat the temporal area. Do you have any question? Yeah. Then
دكتور ما في مخدر عشان أدم.
Then for the mid phase, what she needs is actually to lift this a little bit up. You see that? To treat the tear trough deformity. Here we have the eyelid cheek junction. We have the mid cheek groove and the nasolabial line. Okay? For the mid phase. So we will inject a little bit in the nasolabial triangle here, and with the technique of double XL injection, I will, with cannula, lift this up a little bit. Why the double XL? Because the double XL, it's not getting it's not hydrophile, so it will not bring the water in. So the technique is you make a small hole about 4 centimeters in front of the ear like this. The ear lobe is there. You put 2 fingers. You make a small hole here. So I do a little bit of lidocaine. Give me the needle and give me a double XL with cannula. And I will make a fan technique from this point all the way to the nasolabial to lift this up. Does it go through this? This is 27, yeah. 25? 25. Okay, so this is the double XL. You see? I will go all the way to this point. Gently. Here we are. You see that? And start a gentle linear retrograde injection. Second one. Third one. This technique you can only do it with the double XL because of the chemical properties. 23, you have 23. Give me another. Give me a gauze, sister.
This for the XX doctor from the box of XX.
Okay. Give me a gauze. Thank you. Okay. It's good. Can you keep the patient and look at what happens with this injection? Can you sit? Okay, look at the difference. I didn't touch the nasolabial area at all. So just by getting a convergent injection from this point with double XL, like this. Okay? This is the only thing I did in this side. And give me now one L or XL with needle.
XL doctor.
XL, yes, with needle. And then, so the first part was done with the cannula, and then with the needle, what I will do, I will fill up the deep medial cheek fat compartment like this. A bolus injection deep on the bone on the deep medial cheek fat compartment. Okay? And then a second bolus on the nasolabial triangle. Again on the maxillar bone. And just to finish the medial part of the tear trough. Okay, we are done. Give me alcohol, please. So I have finished with the mid face on the left side. Without never injecting the nasolabial line. You see a natural improvement,
مخدر
no ecchymosis,
مخدر في ألم
no blue, and very natural. Huh? It's magnifique, it's very nice. Here. Okay. So we will do the opposite side. One guy, like the cane. So do you have any question? Question? No. Alcohol. So 2 finger here. Two finger here, a little bit of the lidocaine for the entry point. Give me the, one double XL and the rest of the previous double XL. Remaining one. And if you need it from the same entry point, you can also go to the temporal region, as you see here, in order to increase the volume there. So, as she has a light asymmetry in between the two hemifaces, I just put a drop here under the eyebrow in the right side. So I will take the XL with the needle. So again, here I will go to the deep medial cheek fat compartment on the bone to create a bolus. Then more laterally. And then the nasolabial triangle. Here we are done. Sit down, please.
Majid,
Very nice
close the light.
improvement of the knee face and temporal. Very nice, very nice. Where is this people? Can we make a coffee break or what?
Let me ask.
When we do this. Okay, look at the nose. Can you show the nose from here? Look at the nose. There is no support here. You see? There is no septum. There is no support. The angle is closed, so I will turn this up. I will hide the hump here, the bony hump, and we will work on the tip. But always clean the mucosa inside with some alcohol. It is important to clean it because of some bacterial contamination. So I clean the mucosa with the alcohol pad. Then we will do a 3-step injection. The first one is at the labiocolumnar angle here. You see? You go right in the middle, deep to the bone, like this. Okay? And then you make the first bolus of about 0.2 to 0.3. Then you turn the needle at 45 degrees, you make a second bolus. Then you turn the needle, put it horizontally at 0 degree, and you make a third bolus. And the first step is done. And look at the nose.
Amazing.
Huh?
Amazing.
It's amazing. And then the second part, we go here in the dorsum, in the middle, deep on the bone, and make a linear injection from the hump to the nasofrontal angle. And by a light massage, you make this transition supple. You see? And then to finish, we can add a little bit here. Can you open another Excel? You see the nose? And look at this. And just to finish the nose job, I will add 1 drop here. And then I will add 1 drop at the tip here. You see? But I will go through the nostril. Don't move. Like this. Okay, and it's done. Can you change me the needle of the... Amazing result. Look at the nose. Look at the nose. It's like a surgery. You see here the curvature I made on the tip? This is very important. So just to finish for her, we will increase the projection of the chin because she has a short lower face and it's important to increase the projection to increase the height of the chin. That will completely change the lateral view on her face. Here we are. We finished. Have a sit. Amazing face. Completely changed. Look at the lateral. Record from lateral. Look at the chin, projection, the nose, with this small injection on the tip. which gives a she has dramatically changed.
Change. 20 years becoming more.
Yeah. Very nice.
Thank you.
You're welcome.
Doctor, do I need to put the receipt on?
Yes, please. So, go in front like that. You see here, temporal areas are very deep. So she needs to be treated in this area. So the same thing in the opposite side. Then she needs a little bit here in the glabella, so I will show you how to treat the glabella. Then she has the tear trough here in the middle part. Then I will do for her the double XL lifting process, like this. Then we will treat the nasolabial triangle. We will treat the marionettes. Always combined with the chin and the jawline. So it's a let me so our plan will be 1 cc of double XL here, 1 here, 2, 1 cc of L here and here. So 2L, 2 double XL, and 2 XL. L, XL, and double XL. Okay?
Relax, warm down.
And let's check. Let's check if there is a constant anatomy or not. So facial artery here. Can you make like something we see the patient and the screen together?
This
Yeah, like this.
Both of them is
So this is the facial vein and the facial artery.
this is from the pulse.
Yeah, the red is the artery. Here, you see that? Very nice. So where we are, right in front of the masseter. right in front of the masseter. Give me a white pen, please. Here. Look at this. Here is the bone. So we are deep on the bone. This is the masseter muscle. Press your teeth. Press your teeth.
Should madam? Asnan. Should. Ayo.
Look at this. This is the muscle. Relax.
Relax.
You see this here? When she contracts the masseter? Do it again.
Marathani madam should.
You see? Up.
Should mid asnan.
This is the masseter. And look at right on the anterior border. We have the artery and vein. You see that? Yes. This is the masseter, this is the artery. So this is constant. Then let's go to the labial commissure, 15 millimeters. Here is the artery and vein. You see that? Look at where is the landmark, look at where is the commissure. $15 millimeters. Then let's go up to the nasolabial. There's the vein here. Here's the facial artery. Okay? Yes. And then let's check for the safety of the procedure. Let's check the glabella, because as I told you, is the most dangerous area. So I want to be sure that the supratrochlear is at the right place. Here is the supratrochlear. Okay? So I will put the mark. Supratrochlear. And last one, the superficial tempora. Here. Here the superficial temporal. Okay, perfect. So all the arteries are as usual in the same place. Can you remove the color?
Alcohol.
Yes, with alcohol. Okay. Supratrochlear artery, superficial temporal artery, facial artery to here, and then from here to here. Okay? So no surprise. Okay, give me some lidocaine. I will inject a little bit of lidocaine at the entry point. Brief. One here. One here. One here. One here. Give me another one. Okay. We're done. Now I will use the needle for the hole. Okay, so a small hole at the temporal crest, another hole here. Okay, give me the L, please.
With cannula?
With cannula. So first, as we did this morning, from the temporal crest, beneath the superficial temporal fascia, a fan technique, yes. Okay. Give me the double XL. So I did the temporal injection. You do a massage because here the skin is very thin. So all irregularities will be obvious. So and from above I did a little bit of injection under the eyebrow. So now I will inject the mid-face, no, with the cannula.
Which side will you do?
Double XL.
This is superficial.
No, here, L.
Temporal. Superficial.
Just below the superficial temporal fascia. And now I will do the mid-face. Okay. Are you okay? You see the difference? Look at completely changed. I mean,
No more skin.
give me the XL, please.
Canila.
Need. So here again I will inject the nasolabial triangle and not the line. Deep. I will also inject the pre-jaw, the jawline. So first a bolus at the level of the pre-jaw, like this, where then you do a light massage here, and then from this point we will draw a line so we'll go for under L.
Needle.
Yes. Open the mouth. Open. Close. Okay. Because I will then fulfill this area of marionette, which is a difficult area to treat. For the commissure, I usually go from above. Open your mouth. As I told you, no vessel at the 10 first millimeters. Okay. Keep this and give me another XL for the jawline. So for the jawline and Nefertiti, I start by the corner of the mandible, the angle, like this. Deep on the bone, I create a vertical column. It's not a simple bolus. It's a vertical injection. You see? And then from this point, I draw a line all the way to the jaw and to the pre-jaw. I use needle for that in a subcutaneous. Like this, and then we start again here. And at the end I will also inject the chin. Give me some alcohol, I have it. Can you give me a S? You see, that gives her a sharp and straight transition between the face and the neck. I will just add few drops in the medial tear trough. Open your eyes, please. Look up here. Stay like that. For the tear trough, I use stylage S, needle injection. Separate drops. It's not a linear injection. From lateral to medial and deep on the bone. And it's done. So we finished on one side. The only thing I will do at the end is the chin and the glabella. So have a seat. Sit down. Can you have some light?
Light.
Look at the difference. You see the contour here? The nasolabial, the tear trough, smooth, no deformity. Look at the temp. Look at the fertility here. Very sharp. So I will add a little bit here at the end. Perhaps just one more drop here. And this is perfect. No need for more. Even the tear trough is enough. Never put too much. And you see, I lift this up a little bit. I lift the mid face.
Which side do you consider?
Purple
X-Lord or what?
Here you cannot put more.
or here on the cheek, on the paper.
No, because then,
To make like this, if we put here.
yeah, I didn't do this.
No,
Yeah.
on the other side.
No, you cannot
Put
put
more.
more. Because then you make the skin more heavy. There is a kind of limit. You see?
Because it's natural look.
Yeah. Putting too much, that will decrease the result.
There we go. Purple.
Doctor, which size in the leopard do you use?
No, XL.
And the variant?
L. And here double XL. Here a little bit of S. And the temporal L. Look at the difference.
Yes.
How deep is there. So I will do the same thing, and at the end we will do the touch-ups. Okay.
See the difference? هيك شوي.
Very nice.
تمام.
خالصة ولا
لا بيعمل هذا الطرف. بعدين بيعمل لك هيك.
It's amazing. Okay. Oh no, keep this for me. Give me another one. Is she a smoker?
Yeah, heavy.
Yeah. So entry point at the temporal crest, you go deep, you touch the periosteum, and then you turn your hand and you let the cannula go. And if we make an ultrasound, we will see that we are in the right plane. You don't have to do anything special to be in the right plane by getting an entry point at this level. When you go from below, it's different. When you go from the zygomatic arch, it's more difficult to be immediately in the right place. So then we start a fan technique slowly, slowly. Don't create any deformity, because the skin is very thin. And you see sometimes I inject just a little bit below the eyebrow to lift the eyebrow up. Smooth and natural augmentation of the temp. No irregularities. Okay, the double XL. Then the mid face. Okay, give me the XL. Bolus, deep, at the level of the nasolabial triangle. One bolus on the pre-jaw, again on the bone, to stabilize the jaw. I will add just a little bit in this side also. This bolus stabilizes the movement of the jaw forward. Then you mold it like this. Give me another XL. She will be wonderful. Amazing.
After for the career,
Huh?
for the full picture, not Russian like.
Yeah, but the problem is this. Yeah. Look at the chin. We go right in the middle. Make a central bolus. Okay? In order to create an oval shape of the face. Then from this central part, we create one left and one right injection. But don't make the chin too wide, because this is not, that will masculinize the face. Perfect. I have still 0.2 that I will inject right in the middle of the glabella. As I told you, arteries are in both sides, so you go in the middle, and then from the medial entry point, you go one left and one right. That's it. Don't put too much filler here. And you can also decrease the contraction of the muscle with Botox here. Okay. Then I will ask for the L. Do you have an alcohol? So the L, we put it in all this area. Open mouth, open, open. Okay, and then the XL, we are done. Big change. So for the Nefertiti, I explain to you again. You go at the gonion, they go at the corner of the mandible, deep on the bone. You create a vertical column. It's kind of bolus, but it's a vertical line, like this. And from there, a subcutaneous line to the pre-jowl. Okay, and then the S, the remaining S. Unbelievable. So for the tear trough, always ask the patient to look the ceiling, look up, okay? And you go from lateral, but she doesn't need in the lateral side. If she has a complete tear trough deformity, I should have started here. But now I start only where the deformity starts. Small drop, interrupted injections in order to avoid tendal effect, deformities, bananas. 3 little drop and a slight massage. Yeah, you should do some tuxing for her in the glabella and in the frontalis. And then after 1 week is good. Here we are. Let me put some fusicord. Very nice. Really.
Thank you.
She's like she has been facelifted.
Facelift.
Yeah.
30 years younger.
No, like sisters.
شكرا لي يا ماما.
Yeah. Really.
Mashallah, madam. Thank you very much. Now we'll take a picture for after
Yeah.
and comparing.
خلاص
حط لك passport.
ما بسمع.
حط لك الدواء بس.
Put the facial artery at the beginning, and then here 15 millimeters. You have a ruler here if you want. So this is the beginning, and here you have 15. No, 15 is at the corner of the mouth.
The corner of the mouth
Yes.
here, but just also we have here.
15 is here. Yes,
Yeah.
here. Like this. Yes. Somewhere here.
And here,
And here is 2-3 millimeter above the line. Two, 3 millimeters from the nasolabial line.
here.
Yes, somewhere here. Like this. Okay?
Yes.
So the facial artery is something like this. Okay? Then the supratrochlear and supraorbital.
15 from the middle.
15 and
From
30.
the middle.
15 and 30. Yes. And then the temporal superficial is just along the hairline, like this, coming to 15 millimeter in front of the earlobe here. Yes, yes, perfect. So it goes like this. Okay? So here is the probe. I don't have a lot of battery.
How much it costs?
So this, in France, it's about 3,000, 3,500. It's not so expensive.
Euro or dollar?
Or euro. And you don't need the tablet because you can put the app on your iPhone.
Yeah, I saw it in Syria. Some radiologist, one of my friends, he's in France.
Yeah, it is important for us to do that because now all the, angiologists, those who are doing for veins, they are telling everyone that they are the specialist of the vessels, so they know better the vessels of the face than other doctors.
It's amazing.
Okay, so go, just stabilize this.
Any push or just?
Not too much at the beginning. And don't move too fast. So stay like that. I will put on a Doppler. This is the Doppler. So it's here.
Mm-hmm.
So you see that your landmark is right.
Right here. Almost
You
right.
have to work the position and also sometimes the incidence.
Mm-hmm.
Go slowly. Somewhere here. Yeah. Go a little bit on the right side. Yeah. You are in the. Yes, perfect. Because this is the muscle.
Mm-hmm.
And this is the facial artery and the vein.
So it's here, almost near my line.
You see? Exactly at the landmark. And then, okay. Here. Good. Here is the vein. And the artery should be closed. And then go for the facial artery. Come a little bit lower at the level of the corner. Yeah. You see here?
Yeah. So I will move right or left, when I
This
see
is
left.
Wait. This is, yes, perfect. Somewhere here. Yeah. Yeah. You're there, yeah. Perfect. So, where is it compared to the landmark?
It's the same, higher a little
Same.
bit. The same.
15 millimeters.
Yes.
So you see, this is our third model. Always the same place. Always, always, always.
How they teach us? It's verify from person to other.
Because the doctors who say this, they even don't know themselves. And try the yes, yeah. I think you are not far from it. No, go down to the wait. Somewhere here. Yeah. If you go, yeah, come to the here. Oh, battery faible. I will be out of battery in a few minutes. Oh, dead. Okay. So, thank you.
Thank you for you.
Can I try it?
Sorry, it's out of battery. Or can we perhaps send someone to my hotel's room?
Yeah. Faisal?
I left the shot like this to treat a little bit the tear trough and nasolabials, and we will also inject a little bit here. And you want the lips, you told me, right? Lip? Okay, and we will do also the lips for her. So I will show you the technique for the lips. Give me the Lido, please. Okay. Temporal area. The entry point. The nasolabial triangle. And here. I will do some anesthetic, okay? Breathe. Okay. Give me the gloves. In this type of morphology with the round shape, heavy face, it's very useful, the double XL. Give me the needle with the double XL. The needle? No. The needle and with cannula, yes. Give me one L. With camera. Do you have a glove for me? Guys. Let's go. I will do the temp now from, she doesn't need too much volume in the temporal area. It's more for lifting her eyebrow. So I will go below the eyebrow because she wants a brow lift. So it's more about okay. So give me the needle now. And give me one S. So I have done the mid face, the nasolabial triangle, and the brow lift, the temp. I will just add few drops like the previous model for the tear trough. And we did one side. Okay, sit down please. Can we have some light? You see, only with 2 syringes in a heavy face, this is very difficult. You see, lift this up, the tear trough, the eyebrow. Look at the position of the eyebrow. Look at the shape of the mid face, the tear trough.
Doctor, please,
So,
your phallic technique starts from where? This is your entry point.
yes,
And
here.
then the first line.
First, second, like this.
The last one here. To
Yeah.
the angle of the mouth here?
No, to the here to lift this corner up. You see these sagging things?
Yes. It's directly here. Now, if patients wants to put filler here, we put at which level here?
Subcutaneous. You can do it from the same entry point.
Doctor, can you mark for me the masseter here? Masseter muscle.
Masseter here. You ask the patient to. Huh? The teeth.
بيزي على اسنانك.
Yes.
ضغط على.
Relax. Relax. Do the close. It's here. This is the masseter.
Up till the tragus. Doctor, if you want to inject Botox here to slim her face, where to inject?
So I usually, you draw the masseter. I usually put one first line every 1 or 2 centimeters here and one second line like this. That's it. So the lower part of the masseter.
How many units per each point?
I use this port. I don't know if you're using this port or elegant, so it's a little bit different. With this port, I put a bit between 15 to 20 units per point. It's about 10 units of Botox. So with 100 vial, you do both sides. So we start the same thing here, the entry point. Here, the entry point at the temporal crest. First the double XL. You see, you start the first line here. And you inject slowly. Usually each line is about 0.05 ml or 0.1 ml.
Until you reach the nasal level forward?
You stop a little bit before, yeah. You go as far as you can with your the cannula. You see, look at.
No, nunca por debajo. The L cannula. Give me the needle. This, in order to make the transition between the mid-face and temp
more smooth, and especially to lift up the tail of the eyebrow. The needle, please. And here, the nasolabial. Okay, give him the S. Alcohol. Okay, we are done. Very harmonious result. Look at this. So you see, very smooth face.
She do a surgical face.
Yeah, really. Very smooth and natural. So the last thing I will do for her, because we have other mothers, I will show you my technique in lips. Okay? Okay? Very nice. Can you come a little bit up? So for the lips, you can use the stylage lips. I don't know if you have here, because you have lips and lips plus, or M or L. So for her, I think M is enough. So I usually go at the head of the patient. This. I will do a fan technique. Usually I use 2 and 3.1 at the filtral crest, like this. A second one at the middle of the lip. One side and then the other one. Okay? So the tip is up. I lift up the lip. I go from this entry point, not too superficial but not too deep, submucosal, and I create a fan technique. My left index is keeping to lift up the lip. You remember the slide I showed you this morning? Where are the arteries in this? They are in the vestibular part. Nefes. Okay. So one side is done. So same landmarks, filtral, crest. Brief. Second one. Here we are. Can you change the needle? Okay, it's enough. Then we will do the lower lip. The lower lip, I do it the same way, but from below. think I need a little bit more of. Have a sit. Sit down. Perfect. Very nice. Can you put some pussy cords? Completely changed, huh?
आ जाते हैं अब
Because of the enzyme, she's very empty in this area.
It hurts here.
Don't touch me.
Here.
So I also inject in the mid face because the mid face is the support of the suf. You see the difference? Completely resolved. Give me some fusidine, fusico. Okay, perfect. Let's do the other side.
Good.
Very good. Look up. You see the difference here? Look down. Look up. Look up. Can you change the needle, please? Thank you. Look up. give me the syringe. Okay, perfect. Very nice and smooth. Never overcorrect this zone because after 2-3 days it always gains some volume. You always under the volume that you would like to put.
Thank you.
This side is bigger than the other one. Guys, so remember the technique. So I don't know if you've seen, look at the left lip. Left lip is much bigger than the right one because she had previously HA injection. Then she removed it with enzyme.
Orokan tsaka sa tayo.
Ayaw kanina
Isn't it? Micah, can you hold it?
That's yours. Scandalous.
This is alarm for them, so I'm sleeping in the daytime.
Okay.
और तो पकड़ेंगे 1 सेकंड पकड़ा
Okay, what? So you see I've injected 0.5 in one side and now it looks like it's symmetrical. So the big difference. So I will add a little bit in the left lip, but not much, just because this one is more dense, the one I just injected.
It's not working.
Picture this one?
Hold on, we did.
Perfect. It's like fibrotic in the lips. Not easy to inject.
Just maybe if you want to do some lifting. Not very much.
More, doctor?
No, it's okay. Very nice. Give me some pussy core.
Nice.
Go. Very nice.
Hello?
See straight.
Thank you.
Very good.
She do her lips before 3 months and her nose she needs some.
Lips is good.
No, not lips, nose.
Only nose?
لا أو حتى الصدغ عندي كتير داخل لجوا يعني منطقة كده
Temple area.
يعني إذا بقدر إنه يعملها هيك يفتحها.
She asked me that the plastic surgery you not like it because some before she has some.
Scar.
أيوة.
Who did it? Who did the before?
شو اسم الدكتور؟
وين دكتور أيد في مصر؟
ليس بمصر.
وقت السلام.
On Egypt.
And now you want nose and here? Temps?
Temple.
مخاري هنا ما بدي.
لا
بس
أيوة.
هاي المنطقة.
This.
Yeah.
Well, haunted. Just.
Better. What doctors see what is
أيوة.
need exactly.
وتكساس إذا بده يسوي.
No, this is good. No, here you are good. Oh, here. The nose.
أيوة.
Look at doctor here. we draw the aesthetic dorsal line of the nose. So we will fill up this area. So we will not see the hump anymore. But if we do that, perhaps I need to inject just a little bit here. Yeah. The angle here is good. Not gonna touch it. And then we will work on the temporal area. And raising the tail of the eyebrow. Huh? And put a little bit like this. That will be nicer. Come on, give me some light again. So, she looks very great. I will work on the nose, fill this part, fill the tip, lift a little bit this zone, and the tempora. Okay. Give the needle for the give it gas. So you first make the hole here and here. Give me the XL first with double XL. So we will lift this, okay?
Okay.
First line, second, third, and we repeat this in order to lift. So the hole is done. We go perpendicular. Now we are in the right plane. You see? Here we go until the end of the cannon. And then very, very slowly we make a retrograde line. Okay? Come on.
You done with this, the top?
Yeah, you lift this up. Don't go too deep. Yes. And now you inject retrograde. Yeah. Come on, come on, come on, come on. Come on, slowly, slowly, perfect. Okay, repeat again here. gently, gently. Gently, yes. Perfect. A little bit more here. Give me the L. When you pull out the needle, the cannula, you keep injecting. Understand? Don't put one bolus, then one under. You keep the same pressure. And then from the same point, we also will go under the tail of the eyebrow to create a column here. That we will complete with the L from this part. Yes. This is double XL.
Double XL.
Yeah. This is very nice. And then for the L, this entry point from the anterior temporal crest, you just follow the anatomical plane and you are in the right one. And this one, very, very slow injection, because there each single irregularity will be obvious. Very, very gentle. Perfect. Yeah, perfect. Slow injection, you see? Perfect. Have to come up and then create a new tunnel. Yeah, come down here. I think it's enough. The rest we will put it from there. We have to lift this up. Okay. That's it. See the difference? Nice projection. Yeah, with the S. So you see the eyebrow is totally lifted.
Yeah, very nice.
Here we have a nice curve. Okay, let's do the other side. The needle. You press this.
على فكرة محطة بنجا من خاري
Good.
يوجعني.
She doesn't apply any cream here. So she afraid maybe it will be painful.
Where?
Here, the nose, because she doesn't apply any analgesic cream.
لا ما بده.
ما بده.
بقول
No pain.
لا ليش no problem معنا بوجعني.
And from here up to there. Give the L, please. Or change it because if it broken, if it breaks inside.
It's a small one. Give me that.
Sometimes you have to make the hole, or the beginning you get the beginning, you go like this, you find that. Give the needle, sister. Okay. And then you are in the right plane, you see?
Mm-hmm.
And then you go gently, gently, gently. Yeah. Good. Yeah, you have to find the right plane.
Mm-hmm. enough. Doctor. I will go from down.
Put a little bit here. Here. Yes. Come up. Just a few drop here.
From the other.
Yeah, and then we will do from there. Go from there to here. Yes, perfect. Yeah. Perfect. Okay. And now, from here, I will have this. Nice. Okay. Alcohol. And do you have one additional L for the nose?
ما بدي احط هذا
تخدير.
ما بده.
ما في داعي. أقول لك شغلة بسيطة. لا.
شوي. Very nice. For the nose, the dorsum, you go right in the middle. You see here, from the hump all the way up, you go in the middle to the bone, and you put your fingers in each side, and you inject, not too much. Then you do a massage to make the nose straight. You see that?
Nice.
Don't put too much because then you will widen the nose. Just a little bit like this.
Some
Give me
doctors
the-
using the night camera.
There are areas for cannula, areas for needle. Nose, it's not a good indication for cannula. So don't move. Don't move. Just, you see, a small drop. Finish. Finish. All finish.
Any infection, doctor, because you inject
Hey.
from inside.
No, you clean the mucosa before and that's it. She has a small...
You have eyes?
The nose is perfect.
رجعت كيف شوية.
German.
You're welcome.
Thank you.
Sure.
أيوة خلاص.
You can take a more picture with a block hole.